The School of Economics and the University of Cape Coast, in collaboration with the African Economic Research Consortium, has organized a National Policy Dissemination workshop in the university. The workshop, dubbed Ghana Beyond Aid, Some Reflections and Implications, was organized in an attempt to bridge the gap between academia and policymakers in the country. In an exclusive interview with UCC, Provost of the College of Humanities and Legal Studies, Professor Francis Erica Makwando, stated that the workshop had been held at an appropriate time and that it would help in bringing research results from scholars to policymakers, thereby allowing policymakers to factor research outputs into formulating policies to achieve a cohesive national development.
As a university, at the core of our mandate, although we are involved in teaching, research is at the heart of what we do. And after doing the research, in most times, the findings stay on the shelf, but we have gained the realization that we have to engage industry, the government at a greater length so that some of the findings can factor into their activities. And so we know that as a university we are doing well currently. We have been ranked as the first in the world when it comes to research and its influence, and we want to deepen it. And so our workshop this morning is a step in the right direction, and will sustain factoring research input in all the activities and also passing it on to the necessary agency, government, industry, and others.
Presenting a paper on financing Ghana's National Health Insurance Scheme, how buoyant is existing funding arrangement, Professor Emmanuel Asma commended government for the implementation of the health insurance scheme. He therefore proposed that the policy should be reviewed in order to ensure its sustainability.
The NHIS, briefly as a reform, has taken us forward as far as assessing care is concerned. Unfortunately, what it means now is the problem of moral hazard, where those who don't even have to go and demand care are utilizing it and are pushing it up, which needs to be checked. Otherwise, it's an excellent policy that was put in place. As far as health financing is concerned, we couldn't have gone for any other. This is about a good scheme that needs to be continued. There are certain specific things that might lead to unsustainability of the scheme. And it's exactly the behavior of the people, the behavior of the providers, and political interference. The other one that I mentioned that was also key was maybe we should take a second look at the exemptions. Okay, a large group, I mentioned the percentage of people who are enjoying but are not paying for the scheme. So the burden falls on only a small group, those net contributors, again, who are contributing it. So maybe we should take another look at those who, are being exempted, for us to maybe bring a few more on board. And I was also mentioning some diversification, looking at alternative sources to fund the scheme. The focus has been on curative care. So we wait to get sick, and we think there should be financing to support that. A number of the sicknesses that we report, whether it's COVID, whether it's malaria, whether it's diarrhea, all of them, even some of these non-communicable diseases, can be prevented. What we should be doing with some of the funds that we provide into the insurance fund, it should go into public education. That should get the people now to think about, how they can minimize or reduce this thing about going to seek care and rather prevent it at all. It's cheaper. Okay, curative care is expensive. So maybe the society, all of us should be promoting, including the media, we should be, emphasizing more of preventive behaviors, what we are eating, what we are drinking, the way we are taking care of our environment, and all of the things that cause the disease. There are many things we can put in place to avoid catching them, rather than waiting to catch them and then go to prevention.
Dr. Isaac Bentum, who presented a paper on the determinants and economic impact of tourism in Ghana, noted that tourism contributes greatly to the nation's economy and that it is necessary to focus on the tourism sector in order to achieve the Ghana Beyond Aid agenda.
Tourism is a very sensitive sector that responds to all manner of things. The slightest negative news or negative publication or anything negative, it responds to it. So you can move from the top and becomes almost zero. So we were saying that policies that will improve civil liberties and political rights should be pursued. And then we are appealing to the state agencies, especially law enforcement agencies, to ensure that they don't do anything negative to tarnish the image of the country in the international circles. We need to make some investment to the sector so that the sector will be able to, boom and then bring about economic benefit to our country. So if a cathedral is going to be built and is going to bring in tourists, it's going to promote domestic tourism, it's going to promote international tourism, then I'm all for it. Because we have evidence abound. When you go to France, Notre Dame is there. When you go to even UK, there are other cathedrals there, and every year they bring in a lot of revenue to the various countries. So if we are building a cathedral this time, it's like a sort of investment we are making, and it will bring economic benefit. And as it was said by the finance minister, it will pay for itself in the future. It's going to offer employment, it's going to generate tax revenue, and so forth and so on. So I'm all for it. It's an investment that will bring returns. So that's why I'm all for it.
In attendance at the workshop were researchers from the university as well as representatives from various state institutions, including the Ministry of Trade and Industry, the Ministry of Tourism, Ministry of Finance, Ghana Revenue Authority, Ghana Export Promotion Authority, amongst others. For TV UCC, my name is Nora Derby.